Hi, I'm Dr. Jennifer Sun. I'm a board-certified general surgeon and a breast fellowship-trained breast surgical oncologist. I treat both benign breast diseases and malignant breast diseases. I am here to talk to you today about knowing your breast cancer risk. It is important to know your family history to assess your breast cancer risk. It's important to know this so that we know when to start screening you for breast cancer. There are patients with average risk of having breast cancer. 1 in 8 women get breast cancer in their entire lives. Average risk means you don't have a previous history of breast cancer, no previous biopsies, no history of radiation, or no family history, for example. Screening for the average risk woman begins at the age of 40 and typically once a year. I say typically because different societies and organizations disagree about when to start. It's important to talk to your provider about when to start. High risk of having breast cancer means anyone greater than 20% risk of having breast cancer in their entire life. Your provider will input your factors into a calculator. Typically, it's the Tyrer-Cuzick model or the Gale model. They use factors such as the age when you first had your period, age when you underwent menopause, previous biopsies, your family history most importantly, and the age of diagnosis of your family members. They also include your history such as Ashkenazi Jewish ancestry or if you've used hormonal therapy in the past. Talk with your provider about which model is best for you. If you have a strong family history of breast cancer, ovarian cancer, or even breast cancer in males, genetic testing can be performed to see if you carry a mutation that predisposes you to any of these cancers. Genetic testing usually involves a spit test, a saliva test, or a blood test. The most commonly tested mutations include BRCA1, BRCA2, CHEK2, ATM, PALB2, for example. Patients who are high risk for breast cancer or have a greater than 20% risk of having breast cancer or with a genetic mutation qualify for high-risk screening. This involves a mammogram once a year and an MRI once a year. They are usually spaced 6 months apart. While it may be scary to get genetic testing, to me, it is empowering to know that information. Knowledge is power. If you have a diagnosis of a mutation, we can do high-risk surveillance with a mammogram or MRI. There's the option of chemoprevention, and there's the option of risk-reducing mastectomies. Talk to your provider about which one is best for you. It's important to have that conversation because it is in your hands.